right here on TTT. Well, if you're hearing my voice a little bit raspy, it's because I'm recovering from the flu. But to tell us more about that, it is Grace Sukhchand, and she is the manager of the expanded program for immunization?
Immunization.
Trinidad and Tobago.
Good job. Right. And therefore, he's going to have a lot of questions. But first, thank you for joining us and welcome to the Now Morning Show.
Thank you. It's nice to be here. Thank you all.
Now, it's not so nice to have the discussion because everybody is battling. Carrie is going through it. I'm recovering.
Yeah, I'm on the tail end.
And
luckily.
we've been hearing the use of the word flu, the virus, the cold interchangeably. What are we dealing with currently in Trinbago?
So, the virus, it's basically a virus. So you have the influenza virus, and then you have the common virus that's caused by rhinovirus, which is probably what you all are recovering from.
Okay.
And that's what we normally call the common cold. Influenza, however, is a distinct illness, respiratory illness that is more severe. If you did get the influenza virus, then you would not be recovering so quickly. In fact, you probably would be in bed, you know, very lethargic, very tired, severe symptoms, and it will take you a while to recover.
Right.
Whereas with the common cold, the difference is that you can pop 2 pills and, you know, get a cup of tea, get up in the morning, and you're still able to go to work, move around, do what you have to do. So it's actually 2 distinct disease conditions.
You know, we Trinbagonians like to exaggerate things a bit. So maybe somebody's out there with the common cold talking about, oh no, I have the flu.
Yeah.
And in that case, either case, you have to go to the doctor to have it distinguished, I imagine.
Yes. Yeah.
So do not self-medicate Trinidad and Tobago. Go to the doctors and go to the health centers because we are on top of things, and that's what you're here to tell us today.
Yes, we are. So the Ministry of Health have procured 100,000 doses of the influenza vaccines that is currently available at all health centers throughout Trinidad and Tobago. We are asking the public to go out there and get vaccines, especially particular high-risk group. Right. So there are certain persons that fall under the high-risk group, and these are children between the ages of 6 months to 5 years, the elderly 65 years and over, healthcare workers, because we want our healthcare workers to be healthy while they're looking after these persons.
Exposed to these persons, that makes sense.
That's correct. Pregnant women, we also advise pregnant women, go to your clinics, go to your doctors, get your flu shot to protect you and your baby, so that you can have a safe delivery as well. And we are also asking persons with chronic disease conditions like diabetes, chronic obstructive pulmonary disease, respiratory disease, asthma, go and get the vaccines because it will protect you. These vulnerable population, unlike us maybe who don't have any disease condition or do not fall under the high-risk group, may be able to fight out the virus. But persons who fall under this high-risk group are the ones that would end up with pneumonia, hospitalized, and some persons may die from the virus.
Simply because their immune system is already battling so much.
It's already compromised.
Yeah. When we talk about vaccinations, it actually is some sort of introduction of a foreign body so that your body gets used to combating this particular
item. So it's an inactivated form of the virus that's injected into the body, and what it does is that it causes the body immune system to start recognizing these bacteria, this virus, and start producing antibodies
specifically
to combat that. So that if you are exposed to the influenza virus, then your body is already ready for battle.
So my question then is that when you receive the vaccine, is there any sort of response, or natural body response to it in terms of symptoms we should be expecting? Right.
So we do expect after persons get the vaccine, some persons they experience little minor irritation, redness, swelling in the area. Some persons may complain of a slight sore throat or runny nose, but that's okay. It means the vaccine is working. Right? It's working to produce antibodies in the body to recognize this disease condition.
Some people are sometimes concerned about the risk factors involved with certain vaccinations, including flu vaccinations. Are there any major risks that any specific group of people, say people with any immunodeficiencies or things like that, should be aware of?
Yeah, so there are certain persons that, again, we ask you if there is a disease condition that you go to your doctor for advice before you get the vaccine. So persons who may have a history of Guillain-Barré, who may have a history of seizures, we ask those persons to get checked by a doctor before you get the vaccine. Then there are some persons who may have reacted severely to eggs.
Right.
we ask those persons as well to see a doctor before you decide to have the vaccine. Because if you had a severe reaction to eggs, we may advise you not to get the vaccines.
Would it be that there may be some extract from eggs that are used in the vaccines?
Yes, so there are, it's actually cultured in the protein of eggs.
Okay.
Yeah.
Many vaccines are. Because I've heard that before.
A few of the live vaccines are
Right.
just about yellow fever.
Right. So if you have an
flu.
allergic reaction to eggs, you're probably not going to use that
And
option.
then we ask persons, don't determine if you had eggs, if you consume eggs or your baby consume egg and brought up the egg, it could be the child didn't like the taste of it.
Right. That's not necessarily an
It's
allergic
not
reaction.
necessarily a reaction.
Right.
But we advise you to at least discuss the symptoms with your doctor or healthcare provider so that they can make an informed decision as to whether this child can have the vaccines or you can have the vaccines.
All right.
So speaking of making informed decisions, once we realize, okay, this is necessary, we're heading to the health centers across the country.
All health centers have the vaccines. It's available.
No cost, no extra.
No costs, free of charge. We do have some health centers that have designated Tuesdays and Thursdays as their day to administer the vaccines, but all health centers are given the vaccines on a daily basis. You have child health clinic where it's being administered to children. You have chronic disease clinics where it's being administered to persons with disease conditions, comorbidities. You have the antenatal clinics where it's being administered to their patients as well. But for the general public who wants to access the vaccines, we advise a Tuesday and Thursday to go to the health centers, call your health centers, and they can tell you when to come and get the vaccines.
Oh, that's excellent. One thing that is of major public concern is that of the H1N1 virus. Where do we stand in regards to that?
So H1N1 is one of the influenza virus that is covered by the vaccine. The vaccine
Excellent.
covers for H1N1, H3N2, and influenza B virus as well. So yes, we do from time to time, every year, around the flu season, we do get cases of H1N1.
Right.
The reason why the ministry is purchasing the vaccines and encouraging persons to come out there is, again, to reduce the morbidity that is associated, meaning persons becoming severely ill. If you're ill, if your child is ill, it affects productivity,
Right.
it affects the family. So, we're hoping that persons access the vaccines. We're also asking parents, if your child is ill, take your child to the doctor. Keep your child away from school.
Right.
Because, chances
Again,
are they're
they
going to
will
spread
infect,
the virus. We are also asking persons, again, to practice proper hygiene. Wash your hands regularly.
And properly.
Oh, my goodness. And, proper respiratory etiquette, because do not cough and sneeze openly on persons.
Right.
Cover your nose with a disposable tissue.
Right.
Right.
Dispose of it, wash your hands. If you don't have running water available, use a hand sanitizer. If you don't have a tissue, then you can do it in the crook of your elbows so that you don't spread the virus. If you're ill, do not go to work and share it with your co-workers.
I think what's important, you said there, if you do have to sneeze and you don't have tissue on you, to do it
That's
in
right.
your
The crux of
sleeve.
Yeah, of your elbow.
Yes.
Yeah. So you don't
rather than
spread
in
it.
your hands.
Exactly,
And what's the
because you
reason
might
for
touch a
that?
tabletop, you might touch a door handle, and again, you're spreading the virus. It
Some
is
reason.
a respiratory virus that is airborne.
Right.
So we ask persons to be very careful out there.
Some really good tips there that we can all utilize, and the underscoring of taking care of yourself. If you're not well, don't go to work. If the kids aren't well, have them stay home. These are some really good takeaways, and we really do appreciate you being here, Mr. Grant. We are certainly going to make sure that Carrie heads to the health center next to him. And to those
Once you're fully recovered, go get the vaccines.
Yes.
and for those persons who wanted to call their health centers or do so, of course, I'm sure you can head over to their websites.
You can go up to the ministry websites, and all the health center numbers are listed there.
All right, I want to thank you so much, Grace Suk Chand. You are the manager of the expanded program of vaccinations.
On immunization.
and
Immunization in Trinidad and
That's
Tobago.
correct. And it's a mouthful, and you got it right.
Good job. Flu and all.
Yeah. Thank you very much for joining us this morning and giving us this very valuable information. I do hope that the viewing public would take it to heart and go out there and get their vaccinations. We're going to take a short break and come right back. Stay with us.